Good evening. I'm Gene King, and I'm pleased to introduce my colleague and friend, Kate McGarvey. I met Kate 20 years ago when she was a law student at Columbus Legal Aid. She impressed me then with her focus, commitment, and quick grasp of issues. After law school, Kate stayed at Columbus Legal Aid as a lawyer, managing attorney, and assistant director. She is now the executive director of the Ohio State Legal Services Association. Throughout her career, Kate has focused on the healthcare needs of at-risk Ohioans, whether they are insured, uninsured, or on Medicaid or Medicare. She has battled the feds, the state, hospital systems, and others to protect Ohioans' access to healthcare. Kate was also a longtime board member and vice president of UHCAN, Ohio. Kate is who I want on my side in the fight to improve healthcare. It's a pleasure to now recognize her. Thank you again.
Well, thank you, Gene, and thank you so much to UHCAN for this award. I'm really honored to receive this. I've been lucky enough to work with UHCAN for years on both the health advocacy front and for an extended period of time on the board. And so I'm just really honored to be recognized and given this award. I have really enjoyed the opportunity throughout my career to work in health law, and it's been amongst the most rewarding things that I've been able to do. And whether it's working on policy or comments or working directly with individuals, I've felt lucky that I've had the opportunity to do that, as well as to work with folks like Steve, and before that Kathy Levine, and Charlotte, and other folks at UHCAN. Really, the combination of legal services with the other advocacy organizations is a powerful combination. And when I thought about getting this award, I thought about some of those connections and the push for the expansion of Medicaid, and everything that's been accomplished during this time. It's so easy to focus on the continuing hardships and needs, but I think it's important really also to take a moment and recognize the advances that we've made, and the coverage advances in Medicaid have been massive over the time that I've been involved in this. Clearly a long way to go, but also worth recognizing that without groups like UHCAN and the other people working in this area, none of that would have been achieved. And for me, it's those broad policy changes that have been really important, but also remembering the individuals that I've worked with and the coverage, but also the services that we've been able to get for somebody who may need a type of prescription drug, or may need residential treatment, or who may need services for drug addiction. And some of those folks I've been able to see years later and just recognize the change that that treatment or service had on the trajectory of their life, and where they would have been if they hadn't gotten that, compared to where they are now, and whether it's in recovery or employed, or having been able to overcome an eating disorder which was really debilitating. Each of those things is just a reminder as to why it's so important that we're doing the work that we're doing. So again, just thank you so much for this award. Thank you, Gene, for the introduction. I really, really appreciate it, and keep doing the good work that you're doing. Thanks.